Hello, my name's Jake. I'm the OT student today, and Emma is going to be my patient. My case is Henry. Henry is a 47-year-old male. He was admitted to skilled nursing for severe right MCA stroke, significant left-sided weakness on the upper and lower part of the body. He's a 2-to-1 assist for our transfer from a wheelchair via squat pivot. He is total assist for lower body ADLs and then mod to max assist for upper body. And then past medical history includes hypertension, diabetes mellitus, I think it's pronounced, and then multiple TIAs. So prior to the injury, it's important to note that my client was independent in all of his ADLs. And then he also has a daughter, but she does work full-time, so that wouldn't be possible for him to have a full-time caregiver at the moment for a family member unless we were to give him one. So the intervention that I would like to do is utilizing an adaptive tool, which would be the shoehorn for lower body dressing. I think that this is appropriate for my client as they are just had a stroke, so they're going to be suffering from these impairments for a long period of time. Therefore, I would want them to go home and have some sort of adaptive equipment to use instead of relying on it for a short period of time and then being able to pay for it and use it for a longer period of time. I also want to do some education and different techniques as well. So for upper body dressing, an example of that would be one-handed pullover shirt technique, or possibly if we get further along, maybe doing a button hook or some other adaptive tools. But once again, I think adaptive tools is appropriate because spending the money on this will definitely be used for a longer period of time. And then I can later assess different ADL tasks. I think that dressing is the priority right now due to the fact that they are 2-to-1 to transfer, and I'll have PT kind of work with the gait and moving around and practicing mobility or functional mobility, and start going towards toileting and bathing later on. But I think edge of bed dressing is perfect for my patient right now early on. So we're going to go ahead and start the intervention. So hello Henry, my name's Jake. I'm going to be your OT today. What we're going to do is we're going to practice some lower body dressing. I know you're having some left-sided weakness, so we're going to take your left shoe off here, and I'm going to give you an example of how to do this first. Normally we would want to have slip-on shoes. Do you have slip-on shoes at home?
Yes, I do.
Okay, awesome. So I'm going to show you an example here. I'm going to take my shoe off. So what you can do is you can take your right hand and you're just going to slide the shoehorn into the back right here, and then what we can try to do is shimmy your foot up in there, and I can assist you as we do strengthening. Hopefully we can try to get this more independent, but for right now we're just going to try to slide our heel right onto the shoehorn, and then you're just going to push straight on down, just like that, and it should slide right into the shoe. So I'm going to have you practice this first, and we'll use your stronger arm to do this. I'll get your shoelaces out of the way here, kind of assist you. Alright, you're just going to slide your shoe right in there, your foot right into the shoe, and there you go.
Perfect.
So that is how you use a shoehorn. Once again, I would go further on with education of other adaptive tools, but right now, edge of bed dressing is good. So thank you for participating in the intervention with me.
Very welcome.